stuff. And again, I learn a lot from Rick. I learn a lot from all these events. And as Rick said, I'm sure at some point in time in the near future, we'll be back again together.
Yeah, dude. So we had on our schedule 10 or 15 minutes to discuss how to incorporate what we learned into our practices, or maybe a little parting sage advice. So why don't you lead off there?
Yeah. So one of the first things that I think we always have to mention when we do these type of meetings is, we don't want these massive complications the couple weeks after these courses, because people do things that maybe they're not quite prepared to do. I mean, obviously, Rick and I showed a varying degree of stuff, and some of the things I showed are pretty advanced. I start with very basic things and then move to more advanced, so we can give information to all the different levels of expertise of the participants. But my advice would be, when you see patients in your clinic, don't think about your experience and your opportunity to gain either technically or financially, but think about the patient. It's really all about the patient. If you see someone who you think you can use one of these techniques and help them and give them and help their nose situation, then go for it. By all means, go for it. But if you don't think that you feel comfortable, if you don't feel you've had the experience to execute these properly, then back off and maybe send it to someone, or wait. Talk to the patient, be truthful with them, tell them, I really don't feel comfortable doing this. Maybe I should refer you to this other person who can maybe do a better job. But rhinoplasty is an operation where people just want to take a stab. They want to take a stab at it. And it both Rick and I have talked about this a lot, and we just think that it's great for us to come to these meetings and teach you everything that we know, but we also need to couch that with some advice, meaning that we want you to think about the patient when you determine who you're going to operate on and who you're not going to operate on. For instance, when you're doing primary tip techniques, Elizabeth brought a question and said, when do you consider repositioning and when do you consider not repositioning? Well, if you read my book, I tell you in the book, you should do 20, 30 cases with just lateral strut grafts and dome sutures and no repositioning before you even attempt repositioning. And the reason for that is you need to feel comfortable with setting the caudal margin symmetrically, setting the domes properly before you move to releasing them and then putting them into position. That's a judgment. That there's a lot of judgment that is involved in getting that operation to work. Just putting a lateral strut graft in under lateral crura that aren't transposed is really very straightforward. But if you are going to use the lateral strut grafts with repositioning, I would use it in situations where the tip is asymmetric and the lateral crura are asymmetric, because chances are you're going to make it better. The cases you don't want to do it are patients who have a perfectly symmetric tip and a perfectly symmetric lateral crura. It just doesn't make sense for you to do that early on, unless it's a massively overprojected nose or a massively underprojected nose. So think about the indications that we talked about. Use a progression when you move through the different techniques for dome techniques. Start with dome sutures, then move to, bypass maybe cephalic trim, but do dome suturing, maybe do some rim grafts, maybe do some tensioning, maybe do some lateral strut grafts. And then as you progress, then you can maybe move on to secondary cases. But secondary cases, it's an exponential transition, and it's an exponential jump in complexity. And that involves a lot more judgment calls. And then you have to understand what the potential downsides are, because you can make things worse. And that's one thing we never want to do with any of these patients. So just my advice would be to be thoughtful in your selection of patients, be thoughtful in your selection of your techniques, take baby steps and gradually proceed. And those of you that have a lot of experience, go ahead and if you feel comfortable with these techniques, go ahead and try them. With respect to preservation rhinoplasty, we talked about this earlier. I think the dorsal preservation stuff is definitely very, very promising. I feel very good about it. I doubt that I'll turn back on it. But when you're starting out, either get the piezo and use that as Rick's doing it, or consider getting some experience behind you with typical osteotomies before you really go to doing more advanced dorsal preservation techniques.
Yeah, all excellent advice. Rhinoplasty is not an operation that is ever mastered, and if you really want to be good, you're going to have to set most other things aside and focus your energies on learning. Read everything you can, go to every course you have an opportunity, and early in your career, learn to walk before you run. Learn to dive into the water from the side of the pool before you take up cliff diving. Because if you mess up cliff diving, it hurts. And now with the internet, everybody on planet Earth is going to know that you jumped off the cliff and wiped out. You're going to be on YouTube forever and a day. So choose your cases wisely, choose your battles according to your skill level, and slowly, incrementally increase the challenges you put before yourself as merited by the success of your easier cases. And be patient. Dean and I didn't understand rhinoplasty overnight. This took a lot of years of hard work, and there's a lot of cases under the bridge for both of us. And I still stub my toe. And frankly, some of the stuff that Dean showed today, I would have pause. I'd have to stop and think, oh my God, you put all these graphs and all this. If one goes bad, the whole thing can melt and you have a catastrophic meltdown. So there's many, many things to consider. And I agree that the ultimate thing that you have to keep reminding yourself is do no harm. Do what's right for your charge. This is somebody's life that they're entrusting to you. And the psychosocial gravitas of the nose is humongous. And if you take a bad problem and turn it into a horrific one, that's not going to go away easily.
Yeah, and then just on top of that, Rick said about read and go to meetings, and I do want to just say one more thing about my book. I mean, it's a shame that I have to plug it, but I'm plugging it because I wrote the book as an experience through 30 years of my progression through rhinoplasty. So I talk about the stumbles that I had. So it reads almost like a novel, because I tell you, yeah, I did this and this happened, and so I changed it and went to this, and then now I'm doing this. So I mean, it's what it does is allow you to get into my head and see how you can improve yourself. I mean, there's a mentality and a thought process behind getting better. And if you read the book and you didn't want to have anything to do with the tip techniques, but there's a lot of other stuff in there. But if you just learned how you think through a rhinoplasty and how you manage problems and how you correct issues that you created, if you just learn that stuff, it's going to really save you a lot of headache. And so again, if you want the books available, $200 discount, just contact the Marina Medical guys, and then we can send you a signed copy. And again, this has been a great course. I really enjoyed it. I really enjoyed working with all the Marina Medical guys, Alex and Jeff, and then all the staff. Our Keisha came and helped me out, my scrub tech, and she did a great job. And Elizabeth, that's Rick's fellow, did a fantastic job. So as a group, as a team, we were able to really pull this off. And so the first virtual cadaver course is under our belt and completed.
Yep, but there will be more.
Yeah.
So thank you, one. Thank you all. I think we are officially signing off at this point, and we look forward to seeing and hearing from you again. And, go forth and prosper.